Hello, my name is Dr. Max Greenlee. I'm a clinical pharmacist, and today we're going to go over a medication called Lisinopril, and you're going to learn everything you need to know to maximize your medication, along with some things to look out for, including some pharmacist pro tips at the end. Before we get going, if you have any other medications that you want a full review on, please just let me know in the comments below, and I'll add them to this series on how to maximize your medication. What is Lisinopril? Lisinopril is an ACE inhibitor. ACE stands for angiotensin converting enzyme, and more on that in a minute. Lisinopril is used to treat high blood pressure in adults and children who are at least 6 years old. Lisinopril is also used to treat congestive heart failure in adults or to improve survival after a heart attack. US brand names include Prinvil, Cubrillus, and Zestoril. What dosage form does Lisinopril come in? Lisinopril comes in a liquid at 1 milligram per ml. It also comes in tablets of strengths of 2.5, 5, 10, 20, 30, and 40 milligrams respectively. How does Lisinopril work? Lisinopril inhibits an enzyme called angiotensin converting enzyme, or ACE. This enzyme is involved in the production of angiotensin II, a powerful vasoconstrictor. A vasoconstrictor is a substance that narrows the arteries. It also stimulates the release of the hormone aldosterone from the adrenal glands that sit on top of your kidneys. Aldosterone increases blood pressure. By inhibiting this enzyme, Lisinopril dilates or opens up the arteries and reduces how hard the heart has to work to pump blood around the body, which lowers blood pressure. How long till my medication starts to work? Lisinopril starts to lower blood pressure within an hour of administration, with peak effect seen within 6 hours. And you only have to take Lisinopril 1 time per day to get the maximum benefit. What makes Lisinopril awesome? Lisinopril may be used to treat high blood pressure in adults and children over the age of 6. Lowering blood pressure reduces the risk of fatal and non-fatal cardiovascular events such as strokes and heart attacks. It is effective at reducing the signs and symptoms of heart failure. It may increase survival odds when given within 24 hours of a heart attack. Generic Lisinopril is available and tends to be relatively inexpensive. What are the downsides of taking Lisinopril? If you are between the age of 18 and 60, take no other medications, or have no other medical condition, the side effects you are more likely to experience include a headache and dizziness. The dizziness may be due to the blood pressure lowering effects of Lisinopril and may be more apparent when going from lying down to sitting or standing position. Dizziness may also increase the risk of falls, so be careful, especially when you first start this medication. A dry persistent cough, blurry vision, sweating, urinary changes can happen and should be reported to your provider if they do. Rarely, Lisinopril may adversely affect kidney function, so monitoring of kidney function and potassium levels should occur periodically in those receiving Lisinopril. Allergic reactions, including angioedema, swelling of the airways and facial areas, are rare but possible after taking Lisinopril. In general, seniors, children, and people with certain medical conditions such as liver or kidney problems, heart disease, diabetes, and seizures, or people who take other medications are in general more at risk of developing a wider range of these side effects. Who should never take Lisinopril? Do not use Lisinopril if you're pregnant. It could harm the unborn baby. Stop using this medication and tell your doctor right away if you become pregnant. You should also never take Lisinopril if you have ever had angioedema from any cause. What are the most common interactions I should look out for? Lisinopril may interact with some of your other medications, including other antihypertensive medications that also cause your body to retain potassium. Diuretics, NSAIDs, lithium, and aliskiren. Some of these interactions are greater than others, so make sure and go over your med list with your provider and your pharmacist. So is Lisinopril a good medication? What's the bottom line? Lisinopril can be used to treat high blood pressure, heart failure, and to increase survival following a heart attack. However, the development of a dry, hacking cough attributed to the drug may force discontinuation. However, this medication is generally safe, and the majority of people tolerate it well with little to no side effects. So before we wrap up this conversation about Lisinopril, I wanted to give you some pharmacist pro tips because at some point in time, while you're taking this medication, these questions will arise. Lisinopril can be taken with or without food. It doesn't really make a difference, but do your best to stay hydrated while taking this medication. If you miss a dose of the medication, take the missed dose as soon as you remember. Skip the missed dose if it's almost time for your next scheduled dose. And do not take extra medication because this is just going to lead to a bunch of unwanted side effects. Lisinopril may make you feel dizzy, especially in the first few weeks of therapy and when going from sitting or laying down position to standing. Always take your time when standing up. Talk to your doctor if this feeling doesn't go away after a while. Call emergency services if your throat, face, or lips show signs of swelling because this could be serious. For high blood pressure, continue this medication even if you feel well. High blood pressure does not usually have any symptoms. Do not use salt substitutes or potassium supplements while taking lisinopril unless recommended by your doctor because they can increase the chance of you experiencing side effects. If you also have diabetes, you may need to monitor your blood sugar levels more closely during the first few weeks of lisinopril therapy. Do not use lisinopril if you're pregnant or trying to become pregnant because it is no good for your baby. Treatments that lower blood pressure, such as lisinopril, should always be part of a comprehensive cardiovascular risk reduction plan that also targets appropriate cholesterol lowering, diabetes risk, exercise, weight loss, and smoking cessation. Thank you so much for stopping past the channel. I hope this information helps you maximize your lisinopril. If you want to learn more about other medications you're taking, put them in the comments below and I'll make a video on how to maximize those medications also. I put out new videos each and every week, so hit that subscribe button to stay up to date. Until next time, stay healthy, stay happy, and stay curious. And as always, have a beautiful day.